I'll be talking about the role of physical activity and obesity in relation to cancer development and progression. And I think that it's increasingly recognized to be one of the most important factors determining cancer risk, particularly in the Western world. Here at this conference, it's fascinating to see all the very intense genetics and genomics and cellular biology that happens, focusing down really very much on the little factors. But if we look around the world, we see that the incidence of cancers is dramatically different from place to place, and those differences are very plastic as you move from place to place and over time, which tells us very powerfully that although genetics may be very important in susceptibility to cancer, it's the environment that determines patterns of cancers around the world. And there's now an increasing wealth of evidence that nutritional factors, by which I mean not just diet, but in particular factors around obesity, body composition and physical activity that determine the biological interior of the body, that are important in determining those patterns of cancer and bringing out the susceptibility that we can identify through genetic factors. And so we find that there is now powerful associations between obesity and physical activity, and it's quite difficult to disentangle those because physical activity is an important determinant of body composition. And those two factors together are really critically important in at least 10 cancers that we've identified. And after smoking are probably the most important single factor that can be used to help prevent cancer in the first place. We're also finding that there is now an there's importance in obesity and level of physical activity in predicting outcome of cancer once it has been diagnosed, though we're not so sure whether that's causal or not. And so studies that have looked, for instance, at intervening in obesity, which is a difficult thing to do, but by surgery, have found quite complicated relationships. And so it seems to be that there's a lifetime's exposure to activity and obesity that determines your susceptibility. And simply dealing with it at a later stage maybe have some effect, but may not be as effective as stopping obesity happening in the first place, which kind of makes it more of a public health approach that's necessary, not just a medical approach. I think the important thing from what we understand is that as an important determinant of cancer risk, in the same way that any physician would advise a patient who's smoking that it's best if they don't smoke, any patient, whatever they come for, a short intervention to just make them aware of the importance of physical activity and body fatness for cancer is important. Many patients are aware that being fat is an important determinant of diabetes and heart disease risk, but they're not so aware that it's important for cancer. And sometimes cancer is a more important incentive for patients, many of whom have a relative or personal experience of it, and that makes them more concerned to avoid it. So that might be important. Then for patients with cancer, it's very difficult actually, because the quality of research in this area in patients with cancer has been very poor. And so in another area I'm interested in, there's a work done by our National Institute for Health Research, which is bringing together a collaboration of cancer and nutrition specialists to try and increase the crosstalk so we get better quality research in nutrition in cancer patients. Having said that, there's no doubt now that in the common cancers, breast and colorectal cancer for instance, where survival is quite good, especially when it's discovered early, that treatment of the usual comorbidities, obesity and so on, is important because those are comorbidities for heart disease and the things that people die of when they don't die of the cancer that they've been cured of. So as well, it's an adverse prognostic factor. We don't know that it will improve outcome in terms of hard outcomes, but there's really quite good evidence that, for instance, increasing physical activity makes people feel better about themselves, helps them take control of their lives a bit more, and improves quality of life by various different methods of measurement. So I think it's important for physicians, whether they have a cancer patient or any patient, to deal with the obesity and physical activity issue from as early on as possible. I would be cautious about giving confidence that it will improve outcome. As I say, it's very important, and there's good evidence that it improves how people feel about themselves and quality of life, improves physical functioning, especially in later stages of disease. The evidence that it will that improving your weight, for instance, will improve outcome after treatment is not so good. The evidence that it predicts bad outcome if you are overweight or inactive is quite good, but not that the intervention works. And that's what we're looking to try and improve research in that area. On the other hand, there's also no evidence that it does harm, and so I think in general terms that's what I would advise, though the confidence that I would give to the patient that it will actually affect hard outcomes would be cautious.